Welcome back to the third segment on chronic kidney disease. My name is Caleb Ngari. I'm a clinical management trainee at Ponea Health, and today we are discussing chronic kidney disease. With me is Dr. Albert Chesire. We have talked about the various presentations and the diagnostic procedures that underwent by a patient who has chronic kidney disease. And right now we'd want to know, Dr. is chronic kidney disease curable?
So as it is, we wouldn't say it's curable, but we have treatment options for the same.
So for the various treatment options that we have, would you kindly dissect the various modalities that are present for kidney disease management?
So as we had discussed in our previous episodes, is that chronic kidney disease is subdivided into various stages. So stage 1 to 3 patients, these are mostly asymptomatic patients. That means they don't have any symptoms. For stage 4 to 5, these are patients who will have the clinical symptoms that we discussed in the previous episode. So the goals of treatment for kidney disease are majorly around 4 of them. 1, we want an early diagnosis of the disease. 2, we want to treat any underlying conditions that might be present. 3 is to slow down the progression of already existing disease. And finally, for patients who are already in end-stage renal disease or stage 4 disease, we want to start early planning for dialysis and renal replacement therapy. So kidney transplant in essence. So for stage 1 to 3, our goal here will be to halt the progression so that it doesn't get worse than it is currently. And this will involve management of underlying illnesses. And as we had mentioned, diabetes and hypertension are our 2 common leading illnesses that are responsible for chronic illnesses. For the chronic kidney disease. For diabetes, our goal would be 1, early diagnosis of the same. For a patient who already is diagnosed and is on medication, the goal would be to optimize their sugar control so that we have a very good sugar control. So we encourage them to take their medication as they should. If they're on insulin, we encourage them to use the insulin shots as prescribed. We also want them to be very active in terms of an active lifestyle as opposed to a sedentary lifestyle where someone is just seated at home watching TV. We will want to encourage them to go out there and jog and exercise. Maintain a healthy diet, that's a balanced diet. Of course, we have a diet that is prescribed for diabetic patients, where we say we don't want them to be taking excessively sugary foods, processed foods, and so an optimal diet control will promote good sugar control. We also have individuals who use alcohol and cigarettes. They will be encouraged to have either cessation, they will totally stop using the cigarette, or reduce the amount of alcohol intake. For hypertensive patients, the advice will be almost similar with a few exceptions, in the sense that since we encourage them to use their medications and have regular measurement of their blood, or rather of their blood pressures, preferably get followed up at a very specific place. So that is it in terms of the underlying illnesses.
Okay. So in terms of patients who are in stage 4 and 5, these are primarily patients who sometimes would require inpatient care and would require, sometimes in other patients, they'd require various interventions other than lifestyle modifications. What would some of these patients have done in terms of the management of the disease?
So for patients who are in stage 4 and 5, they may have other complications that are related to chronic illness. One of them is anemia. Anemia is where you're having a low hemoglobin level, which, as we know, is responsible for circulation of oxygen in the body. So these patients typically have these symptoms because there's a hormone known as erythropoietin, which is secreted or rather produced in the kidney that helps in the production of the red blood cells. So for such patients, they may require medications to stimulate production of the red blood cells, and at the same time they may have iron replaced in the body because of the low hemoglobin levels. In some instances, some of the complications will involve some what people will call salts, but we will refer to them as electrolytes. You may have low calcium levels in the body because the kidney is also involved in the what we call metabolism or calcium balance in the body. So such patients may require replacement of the same. But more definitively, these are patients who are having very severe kidney disease and are declining kidney function. And the utmost goal would be regular dialysis as they plan for kidney transplant, and at the same time a follow-up by a specialist. So at this point we will advise them to be followed up by a specialist, a nephrologist in that case.
So in terms of dialysis, if you could tell us a bit more. We know that the toxins are retained in the body and they'd require that they be removed manually in the case where the kidney is not functioning. So what are some of the modalities that we have in terms of dialysis, and how does that work?
Yes, so dialysis is sort of an artificial intervention to do what the kidney does. So we are helping the body filter out the toxins, that the toxins are the harmful substances that the kidney normally does. So there are two ways of dialysis. We have the hemodialysis and peritoneal dialysis. Hemodialysis is more relatable, where we use the machine, and peritoneal dialysis we use the peritoneum, which is the part of the patient's own abdomen, to filter out some of those toxins.
Okay, thank you so much. So with that, are there some of home care interventions whereby a patient who's suffering from chronic kidney disease can utilize at their own convenience, so that it just always isn't about going to hospital?
Yes, so here at Ponea Health, we have a variety of options that a patient with a kidney disease can be able to utilize. One, in terms of diagnosis, you can book consultation from a general practitioner or even a specialist in that case. The general practitioner will visit your home and evaluate you as the patient, assess some of the signs and the symptoms that you have, collect the samples alongside a mobile phlebotomist. The results can then be processed and relayed back to both the patient and the doctor. And with that, they're able to assess what the patient has in terms of their current state, in terms of their state of their kidneys. And this offers a lot of convenience for the patient, who will then avoid a lot of queuing if Hadi visited maybe a physical facility.
And also in terms of the Diaspora product, whereby we can have people in the both overseas and also locally, and they have relatives or members of their family who are suffering from chronic kidney disease back at home. So you could be probably, let's say, in the United States, you could be in Nairobi, and you have your relatives back at home in the various counties, in Kakamega, in Nyeri, in Uasin Gishu, and you'd want a doctor to visit them and have this evaluated. This can be done at the comfort of their home, at the comfort of their convenience, whereby they're able to get seen, and you're comfortable that the right kind of quality medical care is afforded to them. Isn't that right, Dr. Ri?
Yes, that is precisely right, as you've mentioned. Ponea Health is able to cater for your needs without necessarily being there physically to take care of your loved one. You can get a nurse to visit the specific patient, given that most of these clients are very elderly patients who have this chronic illness that we've mentioned. You can have a diabetic or rather diabetic specialized nurse who may visit the patient, just do routine blood checks to confirm that the patient is actually taking their medication. If they're hypertensive, they can do a regular blood pressure checks, and also alongside the phlebotomist, they could always get repeat samples for routine follow-up. And you as the client, being located outside Nairobi, let's say you have elder or rather aging parents in somewhere in Busia or even in Nakuru, with our regional team, you will just get your parents reviewed and have their monthly checkups.
And in light with that also, in terms of the array of medical specialists that we have here at Ponea Health, what would your advice be to patients who are in our neighboring countries and they're lacking these specialties? What would you tell them about Ponea Health?
Yes, so at Ponea Health, we have onboarded a large range of doctors who are able to cater for the various needs. We have diabetologists, we have physicians, we have nephrologists, or rather a kidney disease specialist, a cardiologist, and all manner of specialists that then can be accessed regardless of the region that you are at. So even a client who is at, let's say, Rwanda, and is able to access our site, will be able to have these services delivered conveniently. And
yes, and so with that, we get to understand that at Ponea Health, our 5 main pillars, which include price discovery, trust, convenience, reliability, and trust, has been catered for at all times. And with that, we'd like to say that Ponea Health is your healthcare companion. So until next time, that is Ponea TV, chronic kidney disease, discussion with Dr. Albert Chesire and myself. Stay tuned for more in our coming episodes.